This presentation regards transurethral resection of the prostate, TURP, for benign prostatic hyperplasia, BPH, and what you will need to know prior to your minimally invasive surgery. What is BPH? BPH, benign prostatic hyperplasia, is a term that describes the non-cancerous growth of the prostate that can result in blockage of the urinary tract and result in changes in urinary symptoms such as frequent urination, urgent urination, slow stream, and incomplete bladder emptying. What is minimally invasive therapy for BPH? Minimally invasive therapies are procedures done through telescopes or catheters that either vaporize tissue or scrape tissue out to create a larger passage for urine to flow through. Photoselective vaporization of the prostate, otherwise known as green light laser, uses a laser fiber to vaporize tissue. TURP, also known as transurethral resection of the prostate, uses an instrument which scrapes the tissue out to widen the channel. Urolift is a procedure that uses implants to hold obstructive prostate tissue out of the way. Resume is a procedure that uses water vapor to cause a decrease in prostate size. Indications for procedure: urinary symptoms not adequately controlled with medication or as an alternative to long-term medication use. Urinary retention, which is the inability to urinate or empty the bladder. Recurrent urinary tract infections, which are related to an enlarged prostate. Recurrent blood in the urine related to an enlarged prostate. What is a TURP? TURP, otherwise known as transurethral resection of the prostate, is a procedure done through a cystoscope where an instrument scrapes pieces of the prostate to widen the urinary channel. The net effect is the same for both PVP and TURP. Alternatives to TURP: medical therapy, usually lifelong need. You may have sexual side effects and/or other side effects. Other minimally invasive procedures using thermal therapy. Photoselective vaporization of the prostate. This is a procedure that uses a telescope to direct a laser to vaporize the prostate tissue to open the urinary channel. Transurethral thermotherapy. This procedure uses microwave energy to heat up the prostate to cause it to involute. Other laser procedures such as holmium laser enucleation and open prostate surgery, which is usually reserved for only extremely large prostates. What are the risks of the TURP? These include inability to urinate, which is usually temporary, requiring catheterization, bleeding, which rarely requires replacement of a catheter or hospitalization, narrowing of the channel or scar tissue, retrograde ejaculation, which is where ejaculation fluid released during sexual climax enters the bladder rather than exiting the penis, also known as a dry orgasm, erectile dysfunction, which is a small risk, injury to the bladder or ureters, urinary incontinence, which is the leakage of urine, persistent lower urinary tract symptoms requiring additional medical or surgical treatment. Pre-procedure information. As the procedure will be done under anesthesia, you will need to fast starting the night before the procedure. Certain medications, such as blood thinners, may need to be held several days prior to the procedure. A preoperative exam with blood work and likely EKG is usually required, and this is going to be done with your primary care physician. You will need a ride home from the procedure, and a responsible adult will need to be available for the first night after the procedure. Where is the procedure performed? The procedure is usually performed in an ambulatory surgical center. These are usually adjacent to your doctor's office or in close proximity. These centers are specifically designed for outpatient procedures. Some patients, due to underlying medical reasons, may need their procedure performed in a hospital. What does the procedure entail? The patient is brought into the procedure room and placed on the table. Men are comfortably placed in the lithotomy position. Anesthesia will be administered by a board-certified anesthesiologist. A cystoscope is then introduced via the urethra into the bladder, and the obstructing prostate tissue is resected into small pieces with a special instrument. The procedure itself usually takes 30 to 60 minutes, and at the conclusion, a catheter will be placed into the bladder. Instructions on catheter care, which is usually only needed for one night, will be provided. This is a depiction of the catheter and the urine drainage bag. Post-procedure recovery. A catheter will be in place for 1 to 2 days after the procedure to prevent immediate post-operative swelling. You may notice blood in the urine for up to 6 weeks following the procedure, but if there is worsening bleeding, clots, or difficulty with urination, you should contact us. Irritating urinary symptoms, such as the constant need to urinate, intermittent burning, more frequent voiding, can occur and last for several weeks to months, depending on the healing process and the size of your prostate. Difficulty holding the urine can also occur for the first few weeks, but usually improves with time. Instructions on post-procedure recovery. No strenuous activity such as lifting, exercise, or sex for the first 2 weeks following the procedure. Continue with prescribed prostate medication and antibiotic, which is usually prescribed for 24 hours. Discharge prescriptions. You will usually receive an antibiotic for approximately 24 hours. Some physicians prescribe medications to help with burning, such as pyridium and urel. You may also be prescribed a stool softener. When to call your doctor. If you have a fever greater than 101.5, chills, severe pain, inability to urinate, nausea or vomiting, or the passage of significant blood in the urine or clots causing lightheadedness or dizziness. Preauthorization. The preauthorization process is essential. We will communicate with your insurance company to determine your coverage and any co-payments or deductibles that you may owe. We will provide you with an estimate of any charges that you may incur. All charges are due prior to the procedure. Payment plans can be arranged as well. Other urine-based tests that are associated with cystoscopy. Cytology. This looks for microscopic cancer cells in the urine. It is usually covered by insurance. FISH. Fluorescent in situ hybridization test. This looks for abnormal chromosomal changes that may suggest bladder cancer or other urinary tract cancers. This may or may not be covered by insurance. These tests may be ordered at the time of cystoscopy. We hope that your procedure goes well and that you have a speedy recovery. We appreciate your feedback regarding your procedure, as we are always trying to improve the care that we provide our patients. Should you have any questions regarding your procedure, please contact your urologist's office.